is Fox 26 Morning News at 7 a.m.
Skin cancer is dramatically on the rise. In fact, treatment for the disease is up 80% in the last 2 decades alone. So what are the signs of trouble and what can you do now to prevent it? We are asking the doctor just ahead.
Non-life-threatening skin cancers are staggeringly on the rise. More people have had skin cancer than any other cancers combined.
And treatment also, Jose, has increased nearly 80% over the last 2 decades. Fox 26 anchor Melissa Wilson turned to Bellaire Dermatology Associates to talk about the importance of early detection and treatment.
Our viewer Christy was recently diagnosed with basal cell carcinoma on her face, and she decided that she just wants to forget about it and not do anything. And she wants a second opinion because her doctor says you need to have something done. What is your suggestion here? You probably need to not ignore those symptoms.
Yeah, typically with the basal cell or squamous cell, the problem is it becomes more locally invasive. So what ends up happening, it eats a much bigger hole than it needs to. If you catch it early with different techniques such as Mohs micrographic surgery, you can have a 99% cure rate, and it's the highest possible cure rate of anything.
Mohs is something that a lot of people in the business understand, but not necessarily patients. How does that work?
Certainly. So what we're literally doing is if you have a little skin cancer like this, instead of taking a big piece around it and you're wasting some tissue around it, you actually take just a sliver that's around there. And what ends up happening, you trace out the roots, it'll be able to give you the highest possible cure rate with the least amount of tissue that's taken out. So then we do the plastic surgery afterwards, we move the tissue into place, it heals up beautifully.
So you're probably going to be able to take a lot less tissue if people work 100%. If they go especially quickly and 100%. Don't wait around.
And the problem is if we wait too long, then what ends up happening, you take a much bigger piece than you would have originally.
Okay, thanks for talking to us about this.
It's a pleasure. Thanks so much for your time.
If you have a question you'd like to ask the doctor, you can reach out to Melissa on Facebook at Melissa Wilson Fox 26, or you can catch Melissa on Twitter. Her handle is Melissa Fox 26.